Health experts say it is a domino effect. As cases surge in some states, the demand for testing also increases. And as more tests are done, the longer the wait is for results. We talked to one man who says he waited 20 days. Sam Savita of Oak Park had a fever and wanted to be tested for COVID-19 before going back to work. So he went to this CVS June 29th. He says he waited 20 days for results.
You can imagine how frustrating it is trying to get back to work, trying to get back to normalcy.
CVS Health says it tells patients third-party labs are used, saying increased cases and the high demand has caused backlogs for our lab partners, and that it may take 6 to 10 days or even longer for the results.
Between the lack of materials and the volume, it's just impossible for places to keep up.
DePaul University bioethicist Craig Klugman tracks health trends and helps facilities make decisions on testing and treatment. He says delayed results affect tracking and containing the virus.
It makes it hard for us to know what the extent of community spread in is and where the hotspots are happening. Say somebody gets a test in a classroom and we don't know for a week. Do we shut that classroom down for a week?
I fear that people are actually very sick, or I fear that people could lose their jobs because of this.
While he was waiting, Savita went to Rush Oak Park Hospital and got his results within 2 days. Rush says that it processes its tests in-house with an expectation of a returned test within 48 hours or sooner. And there was good news. Savita tested negative. Nationally, testing is outpacing labs' abilities to turn around results quickly. According to the CDC, last week 1.6 million Americans were tested compared to 56,000 the first week of April. Quest Diagnostics, a lab which serves half of physicians and hospitals in the U.S., recently released lab testing data saying, despite our rapid scaling up of capacity, soaring demand for COVID-19 molecular diagnostic tests across the United States is slowing the time in which we can provide test results. As a result, Quest's average turnaround time for non-hospitalized patients is 7 or more days.
The labs are so backed up, they don't have enough people to process the tests.
The executive medical director of infectious disease and prevention at Advocate Aurora Health is also concerned about the impact on public health.
If I were to have the disease, it's important to be able to track down all the people I was in close contact with. And if I have to wait a week or longer for my test to come back, that makes it very difficult to do.
CVS Health says its lab partners are working hard to address the issue of delays, and CVS says it's talking to potential new lab partners to keep up with all the demand. It's important to note that the state of Illinois also has COVID-19 testing available. That information on our website, abc7chicago.com.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.